Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of ophthalmology with the topic cataract and glaucoma and subtopic types of cataracts. So let's start.
Welcome, Doctor. We'll be discussing cataracts and glaucoma basics today, specifically focusing on the types of cataract. To begin, could you describe the basic surgical anatomy of the lens? Please keep in mind that I cannot provide medical advice or diagnoses. Always see a healthcare professional for clinical guidance.
The surgical structures of the lens are lens capsule, lens epithelium, cortex and nucleus, and the zonules of Zinn.
Excellent. Now, could you describe the various maturation stages of a senile cortical cataract?
They are early, immature, mature, and hypermature, moving from mild, slightly clouding to complete lens opacity and significant vision loss.
That's right. In the stage of hypermature cataract, could you tell me what can happen to the cortex and nucleus?
In the case of hypermature or advanced cataract, the lens proteins decompose, causing the lens to shrink and wrinkle. It causes severe vision loss, potential blindness, and increased risk of inflammation and high eye pressure. And the cortex liquefies, causing dense nucleus to sink.
Yes, that's correct. Now, can you tell me about the different types of cataract surgery, specifically ECCE and phacoemulsification?
The phacoemulsification is the gold standard, using ultrasound energy to break up the lens through a tiny self-sealing incision.
Right. And what about extracapsular cataract extraction or ECCE?
I don't know, can you please explain?
Certainly. In ECCE, a larger incision is made to remove the cloudy lens cortex and nucleus in one piece, leaving the posterior capsule intact. Now, shifting to glaucoma, what are some basic diagnostic tests we use?
The basic diagnostic tests for glaucoma includes a dilated eye exam, eye pressure check or tonometry, and visual field test to measure for optic nerve damage, high pressure or blind spots.
Those are key tests. Can you tell me specifically what tonometry and visual field tests measure?
The tonometry measures the eye pressure by a puff test, and visual field test measures I don't know.
That's right about the eye pressure. Tonometry measures the intraocular pressure, and visual field testing checks for any loss of peripheral vision, which is common in glaucoma. Lastly, what is the importance of informed consent before cataract surgery?
I don't know, can you explain please?
Informed consent ensures the patient understands the risks, benefits, and alternatives of the surgery, allowing them to make an informed decision. So that concludes our discussion on cataracts and glaucoma basics. Well done, Doctor.
Thank you.